infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to today's show. Now, May is Myositis Awareness Month, and today I want to discuss what these conditions are, a recent analysis on how they affect women of color, and the importance of this month. So joining me to answer these questions and more is Dr. Cheilonda Johnson. Dr. Johnson is an assistant professor of medicine at the University of Pennsylvania. She's a pulmonologist who specializes in interstitial lung diseases, and her research focuses on genetic risk factors for autoimmune myositis-associated interstitial lung disease, especially in African Americans. Dr. Johnson, welcome to the show, ma'am.
Thank you so much for having me.
You bet. Well, a lot of people may not know what this is, so Dr. Johnson, what is myositis?
So myositis is basically a term that refers to a group of conditions that cause muscle inflammation. And so the technical term is idiopathic inflammatory myopathy, but most people will refer to those group of conditions as myositis plainly.
Okay. Now, is this a condition that's brought on by infections? Is it autoimmune, or is it something entirely different?
So these are autoimmune conditions, which basically is when the body's defense system mistakenly attacks normal body tissues. And there are lots of theories about what causes autoimmunity. I can tell you that in general, it's thought to be due to an environmental trigger and someone with the right genetic background. And sometimes that trigger is known, but oftentimes it is not. Although for many different types of autoimmune conditions, an infection is thought to be the trigger. So it's not an infectious disease, but we think that infections could be closely related to the development of autoimmunity.
Got it. So what type, are there different types of this condition, different forms?
That's right. And so, myositis is an umbrella term, as I mentioned before, and so there are several different subtypes. And so the subtypes include inclusion body myositis, polymyositis, dermatomyositis, and then lastly, autoimmune necrotizing myopathy. And each of those is pretty distinct. I can tell you a little bit about each if you like, or...
Sure, yeah.
So I'll start with inclusion body myositis just because it's pretty distinct from the others. And it's something about this condition is it's more likely to affect men. It tends to affect people who are older than the other forms of myositis. So on average, patients with inclusion body myositis will develop symptoms in their 60s. It's very rare. And unlike other forms of myositis, it's actually more common in Caucasians, and it's pretty unusual in African Americans. Polymyositis and dermatomyositis are often lumped together because they behave very similarly. And the thing that distinguishes dermatomyositis from polymyositis is the characteristic rash that you see in patients with dermatomyositis. And these conditions also tend to have other systemic manifestations, so they can affect other parts of the body besides the muscle, including the lung, which is part of the reason why I'm interested in the disorder. Mm-hmm. And then finally, autoimmune necrotizing myopathy is probably the most rare of the four. And this is something that's triggered by an outside force, and probably the one that we're most familiar with in the scientific community is necrotizing myopathy that's triggered by the use of statins, which are medications that are prescribed to treat high cholesterol.
Now, how severe can myositis get, and are there any really bad complications?
So it can be severe depending on the patients. What we do know about myositis is that it's very variable in terms of how it presents and in the degree of symptoms between each patient. But there certainly are patients who can have a high degree of disability. And so the muscle symptoms can cause people to have recurrent falls, weakness in their grip strength, which can be very problematic with doing day-to-day activities. If you have lung and heart involvement, that can be very severe and result in a lot of disability and, unfortunately, sometimes even in death. Patients can also get a condition called calcinosis, which is where they get painful deposits of calcium under their skin. Difficulty swallowing is also not uncommon, which can make it hard to eat and drink and sometimes take medications by mouth. And then finally, although cancer itself doesn't cause myositis, but it can be associated with certain forms of myositis. And we think that what happens is that the immune response to the cancer actually triggers the myositis in some patients. And so some patients will have cancer as a complication or that's diagnosed around the same time as their myositis. So it can be pretty severe or significant for certain patients.
Yeah. Now, are there certain populations more prone to myositis?
So, the population that's most affected really depends on the type of myositis that you're talking about. So remember I mentioned that, for example, inclusion body myositis is much more common in Caucasian men. Polymyositis and dermatomyositis, however, are more common in women. So women are about twice as likely as men to have those conditions. And it's also more common in African Americans than in Caucasians.
Now, as a physician, how do you make this diagnosis?
So, like many conditions, a very thorough history and physical examination is important because a lot of the symptoms of myositis can be vague or can overlap with other conditions. It's really important to kind of hone in on someone's symptoms. Once there's a suspicion, we generally will start with blood tests, and so we will measure a patient's muscle enzymes, looking for elevation. We can also look for markers of autoimmunity, so those are antibody markers. And there are certain antibodies that are specific to myositis and then some that are associated with myositis that we can measure. Sometimes when we're worried about someone's muscle strength, we can do tests to look at that, so we can do electromyography or nerve velocity studies. We can also look at MRI of the muscle sometimes to look for active inflammation within the muscle. Sometimes even with those tests, the diagnosis may not be entirely clear, and so we may actually proceed to a biopsy. And usually we favor biopsying either the skin, if there's involvement there, or the most affected muscle. And then finally, if we think that someone has lung involvement, we can do a chest CT scan and pulmonary function testing.
So what treatments are available at your disposal?
So the mainstay of treatment is immunosuppression, and usually that begins with corticosteroids, so medications like prednisone, which we usually use to help a patient get into quote-unquote remission, and that's followed by maintenance therapy. And maintenance therapy can either be medications that are taken by mouth or medications that we give intravenously. And then sometimes people who have skin involvement, there are topical medications that we use as well. The one exception I have to mention, though, are patients who have inclusion body myositis, which does not respond to immunotherapy. And so the treatment for that is mostly supportive. The one exception for that are patients who have overlapping autoimmune disorders. They may get a trial of immunosuppression. And so when I mention immunosuppression, I'm really referring to patients who have other forms of myositis.
So is this a lifelong condition? There's no
cure.
Right. Yeah.
And so, this is a condition that we manage with medication, but this is not a condition that we can eliminate with treatment, unfortunately, at this time.
Yeah. And I was looking at the myositis-association website, and tell me if I'm wrong, I came to the conclusion that there seems to be a lot of unknowns still.
Absolutely. I think that, part of what I mentioned before is just trying to understand, why are some patients predisposed to this condition while others are not? What are some of those things that trigger the condition? Because that gets to prevention. We do have treatments available, but oftentimes they're not as effective as we would hope, or they have lots of adverse effects. And so we definitely need to have new treatments that are specific to different patients with less side effects. And then my particular area of interest is just kind of understanding how genetics play a role in this. And so I think that we do have a long way to go in terms of our understanding of the condition.
Sure. Let's go back to the topic of populations. The Myositis Association presented a new analysis on the effect on non-white women. Dr. Johnson, what can you tell us about that, and why is it?
Right. And so, as I mentioned before, patients who have both polymyositis and dermatomyositis, as well as necrotizing myopathy, are more likely to be African American. And boy, do I wish I knew the answer as to why.
Yeah.
That's part of what I try to study with my research, looking at genetic risk factors for developing myositis. But we know that it's not just the fact that there are higher rates of myositis in African American communities, particularly women, since women have a higher rate of having these types of myositis conditions to begin with, but that the way that the disease impacts African Americans is different. And so, for example, we know that African Americans have different antibody markers. And so, for example, patients who have a specific type of myositis called anti-synthetase syndrome, that the type of antibodies that you find in African Americans can differ than what you see in Caucasians. African Americans, unfortunately, are more likely to have more severe lung disease when it's present, and they develop lung disease at an earlier age than Caucasian patients do. We also know that when non-white women with dermatomyositis are hospitalized, that they tend to stay in the hospital longer than non-white women do, and that mortality rates for women of color are the highest among any with myositis, and so they're about twice as likely to die than all comers with myositis, and then 4 times more likely to die than Caucasian men. And so this really is a disease that impacts the African American community very severely.
Mm-hmm. How common is this, by the way? And do you see a lot of patients in your practice with this condition?
So this is a rare disease.
Yeah.
It's estimated that about 75,000 patients in the United States have myositis. I happen to see a lot of patients with myositis, and so my perception is a little bit skewed,
Sure.
but that's because people refer patients to me because of my background and expertise. But,
right.
The general practitioner out in the community may, never encounter a patient with this condition, which is part of the difficulty with the condition is that because it's a rare condition, a lot of physicians are not familiar with the way that it presents, and so there's often a delay in the diagnosis.
Yeah. May is Myositis Awareness Month. Why is this important to you and to anybody else involved in this disease?
Well, I think that, as I was just mentioning, awareness is key in terms of increasing awareness among practitioners. They know what symptoms to look for in their patients, and also awareness among their patients so that when they have these symptoms, they seek attention immediately. And this is important because the disease can be very challenging to diagnose just because of the variability between patients, and that lots of different organs can be involved, and sometimes the organ involvement can seem to be unrelated. And we know that on average it takes about 3.5 years and over 5 doctors for a patient who has an autoimmune condition like myositis to reach their proper diagnosis. And this is problematic because delays in diagnosis are really what result in most of the morbidity and mortality associated with myositis. And so a lot of times, a lot of the disability that patients suffer could have been avoided if their disease had been caught earlier and treatment had been started earlier. And then finally, near and dear to me is just that in order to increase research funding for a rare disease like myositis, we need to increase awareness. And I think that, this is how we increase our understanding of the disease. This is how we find more effective treatments and eventually a cure. This is how we support our patients who have myositis. And so I'm very excited that the Myositis Association started this whole campaign, especially increasing awareness among African American women who are so severely impacted. And so for all those reasons, it's a very important month.
Sure. Dr. Johnson, any final thoughts on this topic?
I think that we definitely have a way to go in terms of improving awareness, but I do see awareness improving over time. And I think that patients should find a little bit of reassurance in the fact that there are active research efforts that are ongoing really to understand all aspects of myositis and to really come up with more effective therapies. And so there's reasons to have a little bit of optimism.
Very good. And for the audience, I will link to the Myositis Association website if you want to get more information. And I want to thank you, Dr. Cheilonda Johnson, for sharing your time and your expertise, ma'am. I appreciate it.
No problem. Thank you.
And don't forget to check us out at the website, OutbreakNewsToday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63.